Welcome to a presentation on StarMed benefits. Today I'd like to talk to you about our company, our very affordable benefit plans, and how easy it is to enroll online. We are a modern healthcare company that realizes the importance of providing quality benefits at just a fraction of the cost of traditional health insurance. Please stay tuned until the end of this presentation, as we're hoping to answer as many questions for you as possible. If you still have questions at the end of this, we'll be happy to connect you with someone at StarMed who can answer the rest of your questions. As an independent contractor or small business owner, you may have found that your access to traditional health insurance is not only limited, but it's much more expensive than you might have expected. An average family of 4 can pay up to $1,600 or more for a traditional health insurance plan. It might have made more sense in the past to not have any health insurance at all. But with StarMed benefits, we want to offer you an affordable package that makes sense for you to pay on a monthly basis so that you save money in the long run. Seeing a doctor once every couple of months can cost up to about $125 per visit. And if you have children, that can add up. Even prescriptions can add up as well. If you have to go to urgent care, those visits can be hundreds to thousands of dollars. And it's hard to budget for those if you're a cash patient. Even though those costs can be so expensive, it still could be less than paying for health insurance if you're not sure you're going to use it. But StarMed benefits have plans that make more sense. If you're going to start paying at $135 per month, which is where our packages start, you know that you probably are going to save money in the long run if you do need to see those doctors or get a prescription or go to urgent care or to use many of the other services that we offer in our benefit plans. Now, I don't want to downplay traditional health insurance. If you or a member of your family has a serious illness or is constantly seeing a doctor or in the hospital, health insurance can be a wonderful thing, especially if you work for a company that pays for the majority of your premium or all of your premium, and you have a super low deductible. Or if your income is so high that health insurance is just another bill. But a lot of the time, those factors just aren't a reality for the majority of Americans out there. And if you're self-employed, you might really resonate with the struggle to find affordable, quality healthcare. So how can StarMed benefits help? Well, we are a healthcare company with a modern twist. We allow our members to have access to the healthcare benefits that they use the most for just a fraction of the cost of traditional health insurance. Our plans start as low as $135 per month, and they include doctor's visits, specialist visits, urgent care visits, chiropractic care, vision care, and so much more. We will go into more detail about what's included in all of our benefit programs, but first I'd like to tell you a little bit more about what makes us a modern healthcare company. And the first thing is that we include unlimited telehealth services to all of our members free of charge. And what does that mean for you? That means unlimited doctor's visits from the comfort of your home, by phone or by video conference. That means you can see a doctor when you're on the road or when it's after hours and your doctor's office is closed. You can see them as many times as you want with no copay, 24/7, 365 days a year, for you and any family member that's on this plan. And the second thing that I love about StarMed benefits is that there are no deductibles with any of our plans. Now, usually with a healthcare plan, you would have to pay a monthly premium that could be very high, and then you'd have to meet a deductible that could be thousands of dollars before your health insurance company would start paying your claims. Not with StarMed benefits. We start paying claims on covered services from the first dollar billed. That means no deductible the very first month you start with us. Now, I need to make a very clear distinction here. We are not traditional health insurance. What we've done instead is to provide benefit packages that include about what 80% of Americans typically use on their health insurance programs. And what we've done is package those rates at an affordable price point so that on your monthly basis, your fees are low and your value is high. So how do we offer these healthcare plans if we're not a traditional health insurance company? Well, we use a process called self-funding, and we act as your third-party administrator to make sure that your healthcare fees work for you. Essentially, your monthly membership fees would be deposited into an account with StarMed benefits. We use these pre-tax dollars to pay for your monthly subscriptions to your telehealth, access to our PHCS network of doctors, prescription discounts, any incoming medical claims, and administration costs. We use our negotiated partnerships with our providers to make sure that you get the most for your healthcare investment. So let's get started on the fun part. We offer two main benefit plans for our independent contractors and small business owners. The first is our Mega Plan. It starts at just $135 per month, and it's our most affordable plan. You can even add family members to this plan or even just a spouse. Our second plan is our Ultra Plan. Now this is as close as you can get to traditional health insurance with our company, and it starts at just $377 per month. Let's talk more about what's included in both of these plans. First and foremost, we include preventative health benefits for wellness checkups. This includes 15 covered services for adults, 23 additional services for women, and 26 additional services for children. These preventative health benefits cover all of your standard vaccinations, screenings, counseling, as outlined by the government standards in the Affordable Care Act. A full list of these benefits can be found online on our website for you to review. As we mentioned earlier, both of these packages come with a $0 deductible. What does that mean for you? That means that we start paying your claims on the first dollar that's billed. Our packages also include unlimited telehealth services. We talked about this before, but let me tell you a little bit more about it. You are allowed to see a doctor or a medical provider from the comfort of your home, or if you're on the road, or if it's after hours and your doctor's office is closed. You can use this telehealth service 24/7, 365 days a year. That means no germs in the waiting rooms. That means not having to be there at a certain time or to have a super long wait before you get to see a doctor. It is convenient and it is simple. So here's how it works. You can either go online or use your mobile app to enter your symptoms and request a visit with a provider. That doctor or medical provider will reach out to you by video conference or by phone and listen to your symptoms and offer treatment options. If needed, they can even call in a prescription to your nearest local pharmacy. I should mention that all of our medical telehealth services are provided free of charge with no copay. But if you're interested in reaching out to a behavioral health representative, we offer that as well for just a $60 copay per visit. You might be surprised at all of the conditions that telehealth can actually treat over the phone or on video conference. Take a look at just some of the conditions that they're able to diagnose. Now, if your medical provider does call in a prescription to your local pharmacy, we also include a discount prescription card that can get you 20 to 80% off of your prescribed medications. We even offer discounts on compounded medications. And if you're interested in finding the lowest price possible for these medications, you can go online to starmedbenefits.org and use our prescription discount lookup tool. Simply type in the exact prescription that the doctor has prescribed for you and search by your zip code to find the closest pharmacies to you with the most discounted rates. So let's talk specifically about our first benefit plan, our Mega Plan. It includes everything we've discussed so far, and it also includes office visit assistance that allows you to see a doctor, a specialist, or a chiropractor in office for a minimal copay. We also offer vision care so that you can see an optometrist once a year for a checkup and have $100 to use towards glasses or contacts. Also included in this package, we pay up to $1,500 in billed charges for lab work and $1,500 in billed charges for outpatient testing as well. What's great about this in-office visit assistance, you have access to use the PHCS Multi-Plan Network of Doctors, which is the largest association of doctors in America. If the doctor you're currently seeing is not in the PHCS Multi-Plan Network of Doctors, you're welcome to continue seeing them with no additional charge. We prefer that you use the doctors in network, but it's never required. So let's talk pricing. This Mega Plan is available to our members for just $135 per month per member. If you need to add a spouse or one dependent to this package, the plan becomes $215. And if you'd like to add your whole family, if you have 1 kid or 3 kids or 10 kids, the whole family can be covered for just $315 per month. If you'd like to add dental coverage to your mega package, you can for a minimal upgrade. $40 for a member, $80 for a member and a spouse or one dependent, and $120 for an entire family. This coverage includes 2 visits to a dental office per year per member, and up to $1,500 in billed charges for non-cosmetic procedures. If you'd like to add emergency room coverage to your mega plan in addition to the dental coverage or on its own, that upgrade is available as well. You can upgrade for just $125 per member per month, $200 for a member and a spouse or one dependent, or $250 for the entire family. This coverage includes up to 2 visits to the ER per year at a $500 copay and up to $7,500 in billed charges. Moving on to our second and final plan, this is the Ultra plan. And again, it's as close to traditional insurance as you can find with StarMed benefits. This coverage includes everything that you've seen in the mega plan so far, and it also includes increased office visits and increased maximums on billed charges for lab work and outpatient visits. The dental coverage and emergency room coverage that were optional for the mega plan are now included in the Ultra plan. And we've also included some supplemental based insurance policies that will provide extended coverage for our members and their families. Our first supplemental policy is for critical illness coverage. If you're diagnosed with a new medical condition while under StarMed's care, you'll be reimbursed for your expenses for up to $10,000. Our second supplemental policy is for accident coverage. This includes things like broken bones, sprains, contusions, and even appendicitis. And this also includes a cash reimbursement. For this policy, there's a list of covered accidents and what their coordinating cash payout would be. Our last supplemental policy provides you with hospitalization coverage so that you would get a payout of $1,000 per day for up to 180 consecutive days for a stay in a hospital. So let's talk pricing for the Ultra plan. A member can have access to all of the benefits that we just discussed for only $377 per month per member. If you need to add a spouse or one dependent, the coverage becomes $599 per month, and an entire family can be covered for only $797 per month. Now please note that both the Mega plan and the Ultra plan can only be canceled or changed once a year during your open enrollment period. So now that you've learned more about our benefit plans, let's talk about how easy it is to enroll online. First, visit our website at starmedbenefits.org. From the home page of our website, click on the Enroll Now button at the top of the page. Your online application will appear, and please fill out the information that's requested. If you're a contractor that uses a DBA or LLC to file your income taxes, please use this information instead of your Social Security number. If you file your taxes with your Social Security number, please use that information instead. On this application, it will prompt you to select your StarMed sales representative from the drop-down menu. If you're having trouble locating or remembering your representative's name, please feel free to call our offices and we should be able to assist you. Please also be sure to enter the main point of contact information for your account, especially if you submitted your LLC or DBA information above. On the next page, please enter your company code in the box at the top of the page. If you work as an independent contractor under a parent company, this code should be available to you from your HR team. If you're working as a small business owner or are an independent contractor without a parent company, please check with your sales representative for this code. Once this code is entered, your pricing options will populate and you can select the plan of your choice. You can select either the Mega plan or Ultra plan as we discussed, and then you can choose to add your family or remain as an individual member. You can also select dental or emergency room coverage upgrades as we discussed. If a family plan is selected, you will be asked to add dependents before you can continue to the next screen. Simply click on the Add Dependent button and enter the name, relationship, date of birth, and Social Security number for each dependent that will be covered under the family plan. When all of the dependents are added, please click on Next to continue on with your application. The last page of the application will ask you to set up your payment account for your monthly membership fee. Please enter your information as directed, And as a reminder, similar to traditional insurance, this program requires a 12-month commitment and can only be canceled and changed through your yearly open enrollment period. Once you read over the authorization information, please sign at the bottom and click Submit. New StarMed members should receive an email to confirm that their application has been submitted. If you don't hear from us within 24 to 48 hours, please give us a call to make sure your application did go through. Once your application is processed, you'll be given your login information so that you can access your account directly from the StarMed Benefits website. Please watch your inbox for more information regarding how to log into your account online and what you can expect as a StarMed Benefits member. As we close out this video, we'd like to leave you with a few thoughts. Our members typically love working with StarMed because we are a simple, modern way to have access to healthcare benefits today. Now, it's true that all of us probably worry at some point that we may get sick, or that maybe some of our family members may get sick. And at that point, you need to have access to healthcare in order to get better and make sure it doesn't get worse. We all have family or friends who have gotten sick and either haven't had health care and are swimming in debt, or have had health care and they've had help to pay the bills that come in that are unexpected. StarMed Benefits can give you peace of mind by offering you a low monthly cost for your health care benefits. And they're $0 deductible, so you don't have to worry about budgeting as much for those unexpected occurrences that come up for medical emergencies. Additionally, if something happens to you while you're on a StarMed Benefits plan and you find yourself needing more coverage, we'll work with you to help you transition to either a plan with StarMed that provides more coverage or a different health insurance company. At StarMed Benefits, we'd love the opportunity to serve you and your family by providing you with quality benefits at an affordable cost. Thanks for watching.